Awesome, brilliant. Can you hear me properly?
Perfect.
Yeah, brilliant. Thank you so much again to the organizers for this event, and so glad to be here. I echo Anthony's thoughts of how much better it would have been to be there in person, but here we are, with lower carbon footprint at least. So Anthony talked a bit about climate change and health already, and he also talked a bit about what we do at the Lancet Countdown. What I'm going to do is just give an overview of our work, what we do, and then show you a bit of the key data that we have from our most recent report. So, as Anthony said, climate change is putting everyone's life at risk. We have direct effects of climate change, whereby it's causing increased temperatures, more extreme and more frequent storms, drought events, flood events. And obviously all of these direct effects will affect our health directly through direct injury, exposure to heat, etc. But also it will affect our health indirectly. It starts undermining the systems that surround us and maintain good health. It starts affecting our water quality, air quality, our food productivity, and the way that we use land. Obviously, all of these direct and indirect impacts are also incredibly important because they are the determinants of our good health, the physical determinants of health. But the other thing that is also being affected by the changing climate is obviously the social determinants of health. Climate change is starting to impact on the systems, the social systems and the social matrix that sustains us. And all of the impacts of climate change will be modified and determined by the social dynamics. The groups that are the most vulnerable, like the very young children, the elderly, those with underlying health conditions, the poor. It will start affecting the infrastructure, our health infrastructure, our sanitation infrastructure, and obviously starts affecting our labor capacity, and that has impacts to the social determinants of health. So climate change and the way it interacts with health and human well-being is really complex and has multiple dimensions. So what we do at the Lancet Countdown is try to capture as much as we can all of these different health dimensions of climate change. We have a working group that looks at the health impacts of climate change, how climate change is affecting our health already. And we also look at what health systems are doing in adapting to that health risk. We look at what mitigation actions the world is taking, and more than anything, what are the health co-benefits and the health implications of those mitigation actions. And we look at the economic and political context. Obviously, we'll never achieve action for climate change, and particularly the protection of health from climate change, unless there's the suitable economic environment, unless we promote the transition to a low carbon economy, and obviously unless we have good political and social support for that transition. So the Lancet Countdown, in its very essence, is a big collaboration. We have 38 institutions around the world, over 120 scientists that are world leaders in each of their own areas of expertise. As you can see, we cover a very broad range of topics. So we draw on the expertise of world experts around the world. And what we do is each year, starting from the commission that Anthony was just mentioning, the 2015 commission, that's where the Lancet Countdown project was really born. We publish annually a report in the medical journal The Lancet. And in this report, we have over 40 indicators that track each of these aspects that we've been talking about on health and climate change. And what we do is look backwards. We try to start from as early as we can. We go back up to kind of the 1950s, more or less. That's where we have the good data. And we track up until today, how has the world been doing in terms of climate change and health? We try to monitor and track progress in understanding climate change as a health issue, in responding to climate change, and in what are the impacts of climate change on health. So when we talk about climate change, the first thing that comes to mind is heat, increasing world temperatures. The world has already reached about 1.2 degrees of warming since pre-industrial times. And on our current trajectory, we're going towards 3 degrees roughly of warming by the end of the century. That is an enormous amount, and it has huge impacts. It will have huge impacts on our health. But what we're seeing is that already the rising temperatures are leading to increased rates of heat-related mortality. extreme heat will impact mainly on the most vulnerable, the elderly, the very, very young children, those under 1 year of age, and those with underlying health conditions. And what we track here with this indicator is the premature mortality attributable to heat of people of over 65 years of age, of that vulnerable group. And as you can see, we have an increasing number of heat-related deaths. It has increased by 53.7% since the year 2000 alone. And if we look at what's happening in South Africa, we saw a 90% increase since the year 2000 to 2004, by the year 2014 to 18. We saw in 2014 to 18, an average of 1,250 deaths roughly attributable to heat exposure. You can see here that upward trend. And obviously, exposure to heat will not only lead to mortality, but also to very, very high levels of morbidity. These we're not currently capturing in this indicator, but it has an enormous strain on our health systems as well. It will impair our capacity to work outdoors. It particularly impacts on those working in the agricultural sector, in the construction sector. We know there's physiological limits to the work that we can do when it's this hot. One of the other consequences of climate change, obviously, is that as the environmental conditions change, so do the capacity to grow food. Our agricultural systems are also being impacted. And the hotter it gets, the faster that crops mature. And when a crop reaches maturity too fast, then it yields a smaller seed. So the crop yields start to go down. And what we capture with this indicator is crop yield potential. It captures the limits that the environmental conditions are posing on our capacity to reach high crop yields. And as you can see, in all major staple crops around the world, we're seeing the potential crop yields decreasing. And by and large, up until today, much of this decrease of these environmental limitations have been overcome through agricultural technologies. But we do see that in many countries, effective crop yields are decreasing, and that they are decreasing as a consequence of climate change, both through extreme heat, reduced change precipitation, increased droughts, flooding events, extreme weather events that harm our crop productivity. Obviously, the direct impact of lower crop productivity is increased prices of food and putting at threat our food security that we've done so much progress in the last years. Another consequence of natural systems changing is obviously a shift in the environmental suitability for the transmission of infectious diseases. We have seen the past year and something more than any time before, I think, how incredibly vulnerable we are to infectious disease transmissions. And what we're seeing with climate change is that the environmental niches of infectious diseases are shifting, or where we find those infectious diseases can be shifting because of the environmental suitability. And we track 3 different infectious diseases at the Lancet Countdown. Here I'm showing you 2 that I think are particularly relevant to Africa. One is dengue, and with dengue we're seeing increased environmental suitability for the transmission of dengue by Aedes mosquitoes, by all of Aedes mosquitoes, but particularly for Albopictus and aegypti. In South Africa, we saw a 9% increase in the suitability of Aedes aegypti for the transmission of dengue. And we know that very similar trends are seen also for Zika and chikungunya. They follow very, very similar trends because their environmental parameters are very similar. Another thing that we track is the environmental suitability for the transmission of malaria. And here what we see is that the conditions suitable for malaria are shifting. In some places they're reducing, in some places they're increasing. But one thing that is really concerning is that areas which we considered before to be relatively safe for malaria, like the highland areas of Africa, countries we don't currently have high incidence of malaria, they're becoming more and more suitable. And you can see here, this is the number of months that are suitable for malaria transmission in the African region, in the highland areas of Africa, and is the highest increasing place in the world. So again, we have a lot of progress that we've made over the past years in controlling malaria, in eradicating malaria in many parts of the world as well. But the environmental changes are making it harder and harder for us to control infectious diseases in many places of the world. So we track many, many more health impacts of climate change in our report, and you can see all of that there. But one of the most striking conclusions that we've reached with our last report is that no country is safe from the health impacts of climate change. We're seeing health impacts of climate change throughout the world, and in many cases they overlap, which means that we have multi-hit scenarios. A country might be affected by an infectious disease outbreak at the same time that is leading with an extreme weather event or with reduced crop productivity. And all of those impacts added one on the other really are putting loads of strain on our health systems that we've seen are already incredibly weak. So with this, it's really important that health systems adapt to climate change and start preparing for these rising risks. The WHO does a tremendous work in promoting adaptation to climate change and in tracking how countries are responding. And in the national survey on climate change adaptation, what they found is that out of 101 responding countries, about 50% claimed to have a national plan in place to adapt to the rising health risks of climate change. However, of those 101 countries, only 17 countries had a budget to at least partially cover those plans, the implementation of those plans. Only 9% said that they had their plans fully implemented. So unless priorities are actually met with increased budget and actual political commitments, those plans will never get implemented. And with this level of increased risks and with health systems already so stretched through a global pandemic, it's really important that adaptation happens, especially to protect the most vulnerable. However, adaptation will never be enough. We know that there's limits to how much we can do to adapt to climate change. And in a world going towards 3 degrees of warming, we know that we won't be able to cope with the increased health risks. So it's really important that we start, we increase our commitments towards mitigation. The carbon intensity of the energy systems measures how much carbon dioxide countries are emitting per unit of energy produced. And what you can see in this graph that I realize is quite complex, but it's pretty informative. In this black line that you can see here in the middle, you have the carbon intensity of the global energy system. And that has by and large remained static. There has been progress done in decarbonizing energy systems, particularly in North and Western Europe. The USA has also done good progress. But there's other countries that as they start developing and increasing and expanding their economies, they're also increasing their carbon intensity. China had increased its carbon intensity for quite some years until the year roughly 2010, 2011, where it started decarbonizing its energy system as well. But unless the whole world promotes decarbonization of energy systems in high, middle and low income countries, this global intensity won't shift. What you can see in the bar graph behind it is the actual CO2 emissions from energy productivity. And as you can see, it is going up. After the 2008-2009 crisis, there was a slight decrease in emissions because of the economic recession. But what happened after that is that as countries reactivated their economies, emissions went up much more rapidly than they were doing before because of that rebound of emissions and economic reactivation. And with the COVID crisis now, we're facing a similar situation whereby emissions slightly fell during the economic recession. But as we start reactivating our economies, we're under high risk of reversing those trends. One of the most concerning things in the productivity from fossil fuels is the use of coal. Coal is really carbon intensive, but also is really environmentally polluting. It generates a lot of air pollution that is really damaging to health. And what we can see is that the use of coal is not really going down. Is this green bars that you see here? It's not really going down. It's actually quite high. South Africa gets its 90% of its electricity from coal. And what you can see in this line graph on the right is the energy supply from coal in South Africa that is going up, is still going up. There was a slight decrease since the mid of the 2000s, but it's still going up over the past few years. And it's the decarbonization rates and the reduction of coal use is really low. And what that leads to directly is premature mortality from ambient air pollution. In South Africa, we had over 10,000 deaths from anthropogenic PM2.5, the most harmful form of air pollution, and 58% of those deaths came from the burning of coal. We have cost-effective ways of replacing coal. We don't need to be using coal. We have other alternatives with are as effective and are also economically viable. So the fact that we're still burning coal in a country like South Africa is pretty outrageous with the huge human costs it has. And one of the enablers of this high carbon intensity of our economies is obviously the fact that around the world we're still subsidizing the burning of fossil fuels. We've analyzed 72 countries around the world, and 58 of those 72 countries had net negative carbon prices in 2017. This means that while some of them might have had taxes to fossil fuels, they're also subsidizing them. And in the net balance, 58 countries were overall subsidizing the burning of fossil fuels. I've marked South Africa here. South Africa is still subsidizing fossil fuels at $12.63 per ton of CO2 emissions, or at least that was the price in 2017. And the most important thing is that the total amount of money that South Africa is putting towards subsidizing fossil fuels is equivalent to more than the 18% of its health budget. Countries are spending amounts of money that are comparable to their health budgets in subsidizing the fossil fuels that lead to climate breakdown, that lead to environmental pollution, and that lead to human suffering and deaths, which is a pretty outrageous situation. If those funds were redirected towards other areas like education, health, sanitation services, the benefit to human health and human well-being would be enormous. We've done this study last year. It was published actually in February this year. That was on a Lancet Planetary Health special issue, where what we did was to model how the world could reach the Paris Agreement goals and what the implications for health would be if we prioritized health in the policies of the Paris Agreement goals. And what we found is that if we really focus on decarbonizing our economies, on reaching Paris Agreement goals in a way that prioritizes health and human well-being, we could save millions, literally millions of lives from improved diets, more physical activity, and better quality of air. And in that modeling, we did modeling for South Africa as well. And what you can see here is that in a per 100,000 inhabitants, by 2040, if we prioritized health in all policies of climate change and of the Paris Agreement, we could save 162 lives per 100,000 from improved diet, 14 to reduce air pollution, and 57 through increased physical activity. So it's really important that the health community is at the forefront of the decarbonization and the Paris Agreement goals to ensure that the health benefits are maximized as we reach, and hopefully we will reach, the Paris Agreement commitments. So that is what I wanted to show you for now. We have, from our indicators, the data is published in our webpage, so you can explore our indicators, the ones that I showed you, and the many, many more that we do have. And many of them you'll find it also at a country level if you're interested. And that's it. Thank you very much.